Hello and welcome to another live webinar, and this time we're looking at maximising the value of digital in Medtech. This is Paul Tunner from Pharma Forum moderating as usual. This one's going to be really interesting. We've obviously done a lot of coverage of what's going on in the pharmaceutical industry when it comes to digital transformation. Today we're looking at the Medtech sector because there's some pretty cool stuff happening over there as well. And as usual with these webinars, I'm joined by a really good ensemble of participants who are going to present their views. I won't give detailed bios, you can see those on the website, but just to briefly introduce who we have on today, we've got Brynn Davis from Edwards Life Sciences, Brynn Davis from Smith & Nephew, Georgia Long has joined us from J&J Medical Companies. We were due to have Sarah Fisher. Georgia agreed to step in at short notice. Thank you very much, Georgia, because Sarah couldn't make this. Dave Pinnington from MSD, and of course Lars Diemer from Agnitio, who are our sponsors for today's webinar. Now you're going to hear more from each of our speakers in a moment, but just to set the scene so you know what's going to happen with the agenda, what we're going to do is have a sort of brief one-slider or so from each of the participants, just laying out some of their observations on what's happening with digital transformation in MedTech. And then we're going to lead into what I hope will be a really good discussion within which you can participate. And we're going to cover off a number of different talking points around what's happening within the medtech sector and what the issues are with regards to digital transformation. As ever with these webinars, you can ask your questions, and the way to do that is to click on the questions tab. You can type those in. Feel free to start throwing those in even now if you like, and we'll try and cover off as many as we can. I know we have plenty to talk about as well. There'll also be some polls, and I'm going to activate one of those in a moment. Very, very simple multiple choice. Just give us a quick straw poll of your views on certain things. We're not going to call out who's voting which way or who's asking which question, so don't be concerned about that. And that may provide some talking points as well. And finally, as ever with these webinars, we're very keen on Twitter, so we use hashtag #PPWebinar. If you want to make observations or throw questions in via Twitter, you can feel free to do that as well. So just moving on, here's our lovely panel. I've already mentioned the names. You can see their faces there, including a lovely digitised version of Dave Pinnington. Pretty cool. What I'm going to do before I hand over to our first speaker, Jerome, is just activate the first poll, because I want to get you thinking about your perspective on digital transformation in MedTech. And the first poll question I'm going to ask you, which you can vote on as we're going through these presentations, is how you see customer engagement, sales and marketing spend around customer engagement when it comes to digital changing in the next 3 years. So you should see that open now to vote on, and you've got 5 options there. Do you see it considerably increasing, slightly increasing, staying the same, slightly decreasing, or significantly decreasing? So in other words, as you look at your company, or if you're working on the service side, your client's company, which direction do you see and how quickly spend on digital customer engagement going? We'll come back and take a look at that a little bit later on. Without further ado though, I want to get our presenters speaking and presenting their views. So I'm going to introduce our first presentation, one slide overview with associated commentary, and this is from Jerome Davis from Edwards Life Sciences. Jerome, welcome, thank you for joining us, and I'm going to move on to your slide and let's hear what you have to say about this. Over to you.
All right, thank you very much. So I have the privilege to have this first slide. Sounds like a little bit of science fiction there. Where this comes from is from a pretty fascinating article I recently read around one of the latest ventures from Elon Musk, Neuralink, which basically has the project to make cyborgs out of us. So that's a pretty rough summary, but and quite creepy actually, but I invite you to read about this. The point Elon Musk is making actually is that we are already kind of cyborgs with the use of mobile, the rise of artificial intelligence, and that we are already quite advanced in the use of these digital superpowers, and this has accelerated in the last couple of years. The impact, so that's pretty forward thinking on looking, but the impact for now in my mind as I look at this, is that there are for users, for end users and the audiences that we are talking to, more and more ways to access information, more and more ways to interact. And the result, in my experience, is the atomization of content, and therefore the need to plan content and outreach in a much different way as I used to do in the past. So hence the importance to take this into account.
Very good. And by the looks of it, the opportunity for each of us to become Iron Man at some point in the future as well. We'll see how that plays out. Thank you, Jerome. I think that's a really good scene setter, and you know, the point about content, I'm sure, is something that we will come back to. So I'm going to keep rolling with these quick fire observations. Just I wanted you to get a sense of where each of our panelists were coming from, and of course that may trigger some questions. So please do, as you're listening to them, feed in those questions. So moving on to our next panelist, I want to hand over to Brynn Davis, who's with Sincera, Potter Smith and Nephew. And we've seen a picture of Iron Man. Now we have a picture of Pac-Man. Tell us what's happening here, Brynn, and where you think we're heading when it comes to transformation in Medtech.
I think Jerome has put me to shame a little bit with my old school Pac-Man image compared to the cyborg. But for me, the observation that I have is that there tends to be this anecdotal view that digital potentially is going to be the panacea to all things analog and all the improvements we want to make and the opportunities that we have. So I really wanted to share some background of where I was coming from at the advent of this webinar. And for me, having grown up on the commercial side as a sales rep and then a manager and then leading a commercial team, my background, and I felt I saw this squeeze on our P&L with the higher expectations of our customers, the variation in the different types of customers, and then, of course, the prices that have been challenged in terms of declining, and certainly in our market. And I saw that pressure from a P&L perspective, but I also saw a pressure from a people perspective. And this was the concern that we were expecting one individual to be superman or superwoman and see many different stakeholders in that process. And I tried to capture on the Pac-Man, the different words that came to mind when I was thinking about answering this question. And back then, a few years ago, I started to research and look into really how and what the impact is of enabling technology to deliver new business models in Medtech, and particularly that impact then on the sales force out in the field. And for me, the exciting part was how could technology enable us to scale and improve in terms of scalability. But I was reading recently an economist from the University of Chicago talk about the productivity paradox around digitization, and really the first wave where everyone expects us to move from analog to digital, where we just take the old processes that we had, paper-based system, and make them digital and expect this huge improvement in productivity, which doesn't occur. I'm really talking about the second wave, which I believe we're in now in the last couple of years, is where we have the exciting opportunity to recognize and to do new things because of that enabling technology and challenge ourselves about those old processes. So for me, it's really one, learning about that first wave and not expecting everything to happen overnight just because you move to digital, but really to look how we can follow a process to improve and use technology to do that. And what I mean by a process is clearly have the objectives of what you want to achieve. You can measure success and what does good look like. I think culture and leadership are vitally important in this, from a visible leadership. And what I mean by culture in particular for me is the comfort to learn and learn by doing, being resilient when you fail, because we will and people will and won't be shy in letting you know about that, but also then having the humility to really look to adapt in doing so. And my final point really, and the observation I have, is those I've seen be successful are being prepared to take risks. And I don't mean take risks in terms of people or healthcare, but in terms of risks with your budget. Whether you have a big budget or you have a small budget, just allocating some of that towards modest improvement of looking to improve the processes, and then harnessing that enabling technology to make the difference and to scale it. And that's what I find really exciting, and I'm looking forward to learning from my peers and the questions that come in on this webinar. But I would say ultimately the technology is not going to do it for you. It's going to be yourselves as leaders, whether large or small, in making that happen.
Very interesting, Brynn, and it makes me think of a conversation I had with somebody earlier today about the Gartner hype cycle, if people are familiar with that, which is essentially saying technology has to be out there for a while before we really learn how to use it and how to scale it, which I think is one of the points you're making. So, maybe we're at a point where this technology is the power pill for Pac-Man there. We can eradicate the ghosts of some of the old customer engagement models.
Ghosts of the past, yes, indeed.
Exactly. Very good. All right, I'm going to keep things moving on. I see some votes coming in, by the way, on that first question. Keep casting your votes if you haven't already, because we're going to come back to that and see how that pans out. I'm going to move on now to let Georgia present her one-slide view on where we're heading. Georgia, I've got to say you've got a fantastic title, Director of Value Creation. That's brilliant. So thank you again for joining us. I know at the start of
Thank you so much. Thank you. Thanks very much, everybody, and thanks for having me join. I think I was thinking a lot about this question of the identifying the biggest shift that we see in customer engagement, and I think overall the big one as we look to digital, but overall using digital to create value, particularly in medtech and in healthcare, is the shift from looking at just opportunities and volume to really insights that are going to drive value. So we see that shift everywhere when it comes to how procurement is happening, to how decisions are being made. Everyone's being pushed, whether it's on our side as an industry, but also on the customer side, to do more with less, which means that when you do look into digital or technology, you really have to look at how it can drive outcomes and how it can drive value and sustain that over time. I think technology is moving really quickly now. There's lots of opportunities and ways that it can move and ways that it can have an impact on healthcare, but where can it really drive value? And I think in a lot of the conversations we're having, and I see in a lot of conversations that are going on out in even the academic world, it's how do we, as you said before, as Jerome was speaking about, drive some processes first, because technology and digital alone won't solve the problem. So really coming together with our customers collectively, I think for us, understanding the needs, understanding the gap and the problem that we're faced with, and then coming together and solving that and bringing the way digital can come in and help to do that.
Very interesting. So again, referring back to it's what we're doing with it, how we're using it. And I think you're referencing earlier on this focus on perhaps we're learning about the quality aspect as well as the quantity, which is of course very easy to measure in digital. Thank you again for sharing your views. So I'm going to move on now to Dave Pennington. And so far we've heard from folks, sitting within the medtech side. Dave's recent experience has been more within the pharma side. But I guess there are some parallels here that we can perhaps look at in terms of where we've been and where we're going to. So Dave, over to you, and thank you again for joining us. Share your thoughts with us on where we're going.
Yeah, no problem. I took the question about digital transformation a bit further. So what I actually noticed in the pharmaceutical industry and in healthcare, when you have a current state and you want to move to a future state, it's very important that you sort of define it. And the problem that we've sort of faced is at the moment we've got quite a very different approach. We've got a very brand-centric approach. We've got a rigid planning model. We've got a push communication model. We're talking about key messages. The content is generally poor. It's a one-size-fits-all. We're using CRM to optimize the sales force, and we're focused on delivery. And what we're finding is that if you look at outside of pharma, if you look at FMCG, you look at other sectors, everything is about customer engagement. It's about being agile. It's about creating that engagement with the customer to really communicate with value, telling stories, and really looking at content excellence, tailoring it. So you're actually creating a completely different engagement model to where we are. And we all know that there's lots you can do there, but it's really important with digital transformation that we have a shared view of what that future state looks like. And within there, what we find is that the biggest barrier to organizational change is that actually the people, systems, and processes that we're driving at the moment are to drive the current state, not the future state. So if you're using digital as a means to evolve to the future state, you have to really create the right roadmap to drive that forwards. And what we've noticed as a consumer, if you're a consumer in today's world, is if you were marketed to, like most pharma companies and most healthcare companies market to you, consumers have a low tolerance for this push marketing. They have a real drive towards this content marketing approach. So just to summarize how that works, if you look at a change equation, to create that change within the organization, you need a certain dissatisfaction with the status quo. And organizationally, marketers, communicators are not rewarded for doing anything differently. So we haven't really created that dissatisfaction. Often that vision is we need to go digital, but it isn't really defined and it's not really a shared objective. And because we haven't defined where we are, we actually don't really set a clear roadmap and take people on that journey. So that really restricts the ability of organizations to change, and the cost of change is becoming greater and greater as pharma and healthcare finds it more and more difficult to engage with customers. So it's struggling, but without getting those three components fixed in the first place. So that's my observation. Paul.
Very interesting. And again, we're covering a lot of ground in a couple of slides there. And as ever with these webinars, if people miss any of the detail, it's available on demand. You can go back and look at this. But I think the point you make, Dave, around, we're kind of fitting technology into perhaps the way we've always done things, whereas maybe there's a different way of doing things, and we need to work out collectively what that looks like in terms of customer engagement, and then apply the technology is a really interesting way to do that. Good, okay. We're going to come on to some questions on this in a moment. So again, keep those questions coming in and we'll try to address some of those. But I want to hand over now to Lars to likewise, share his observations around what he sees happening. And Lars obviously sitting on the service side has a good perspective of a number of companies, how things are developing. So Lars, over to you for your observations.
Thank you very much, Paul. I'm equally excited to be part of this panel and to explore these challenges and solutions ahead of the medtech industry. It seems that there's this underlying word of transformation in everything we talk about. It's sort of become a given, but it's also such a broad term that it might just possibly mean something different to every member of the audience as well as to every member of their organizations. So narrowing it down a little bit to look at another word that permeates the discussion is around digital technologies and to what extent they can be of any kind of help. And so that role of digital technologies is perhaps best described through looking at a couple of different examples of customer cases that for example, Agnesio has been working on. And if we look at Roche, they're in a part of a transformation using digital technologies where the ambition is absolutely that it's a full-blown multi-channel experience that whoever is in the market representing Roche can facilitate towards the stakeholder at hand. So basically having every possible technology available at their fingertips. It still has the risk to be a push strategy, so it becomes important to arrive at that pull part as well, of course, for Roche in the future. Essentia use currently digital technologies in different ways, but currently a little bit more fragmented. It's using it in an augmented face-to-face visit with different stakeholders, and they're getting in return rather advanced content reusage and also data tracking. Philips found a completely different way of applying digital technologies, having a very deep and broad product catalog. They found it a long-winded process to get to real interesting talks with the technical stakeholders, and so they found sort of a decision-making tree to drill down in their product catalogs. And then finally, if you look at someone like Bayer, they rolled out digital multi-channel tools in almost 90 countries, having quite a central approach to this. And what they learned from it was that maximized for them the return on investment of content, in terms of reusing and also in terms of data capture. But so, coming from the broadness of transformation and the broadness of digital technologies, these are just inflection points in these companies that goes to prove that there are quite diverse approaches and quite diverse results. So if we take that up one level and just look at some of the different challenges that face the medtech industry, I'm sure we can all agree that the competition is as fierce as it has ever been. It's a globalized world, of course, but you're also hit by many different tech startups who have a sort of best-in-class solution, or indeed any kind of consumer data or device companies who are already in control of data and who can already capture data. So at both ends of that product picture, you have technology sort of creeping in on your core business. The society, as ever, of course, is on a constant search for a better ratio between investment and outcome, and at the same time are imposing additional regulations. And then the patients, or I should rather call them the consumers, because that's what we should treat them like, they have a much increased knowledge base, take a very critical stance to the advice of the industry and stakeholders, and they want to be informed as and when they need it, or see results or both instantly. And then finally, there's an increasing number of stakeholders, and they emerge stronger than ever in sort of this power battle between a vendor and a customer. This shift from therapeutic specialists to financial stakeholders, administrative, political stakeholders, it's been rather brutal, and that too requires a new way of working. To sum up that slide, we can probably conclude that if we continue to work in the same way, we should probably expect the same results. And meanwhile, the context is changing. So we should work hard individually and as a group to identify what digital transformations fit for your company. So over to you, Paul.
Thank you, Lars. So I think it's a really nice summary of some of the environmental factors which are driving the use of digital engagement. And I want to just sort of specifically make the point, because I'm sure people listening in have picked up on this, but I think one of the challenges with digital is it's a term that's used in a lot of different areas when it comes to medtech and indeed when it comes to pharma. And here we are looking really specifically at digital customer engagement and how that fits in. Not the other areas aren't interesting. So I'm going to move on in a second to some of our questions. We're going to dive into a bit more detail around some of the key issues in medtech when it comes to digital engagement, some of the potential barriers, and also where technology fits into that equation. Before we do that, I want to just take a quick look at that first poll, and I'm going to stop voting on that. And I'll caveat that these are straw polls. We never get everybody voting on these. This is not like a clinical trial. It's not statistically significant. But if you voted in that, you'll see, or you click on votes, you'll see that the result we've got there, where we asked you how you see sales and marketing spend on digital and its importance in customer engagement changing in the next 3 years, we have 5 options. Interestingly, nobody thinks it's going to stay the same or decrease, and it's pretty evenly split, 53%, 46% between considerably increase and slightly increase. Now I'm guessing the people we have on this webinar are digital enthusiasts, so I think there's some happy faces there. That's good news, isn't it? Let's move on, and I'm going to activate a second poll while we go through the next discussion section, because give you something else as food for thought. And again, you know, keep those questions coming in, and we'll come on to some of those and weave them in. But I want you to start you thinking, just as we go through this first point, and we're going to come on to this later on, so we'll take a look at this then, but around what's preventing you from using digital to engage with your customers. Now it could be, we've got 5 options here, it could be a variety of these factors. You might say, well, all of them are preventing me from doing that, Paul. We can only pick one, so pick the one that you think is the biggest barrier to getting you to use digital more to engage with the customers, and we'll come back to that later on. So let's move on to our first discussion point here, and what I want to spend a bit of time talking about now is the key issues for the medtech sector, what impact this has on digital customer engagement, and let's flesh out some of those comparisons to pharma, what can be learned and where medtech is with respect to that. So Brynn, perhaps I can come to you first just to pick up on this point and share some of your observations here.
Absolutely. So for me, the reading that we've done, and Lars has covered it as well, is pretty well publicised in terms of that macro environment. But for me, it first starts with a personal statement that we all have individually and collectively a moral duty to work to sustain these healthcare systems that we not only obviously profit with, and but also for us to try and think about the best care that we can provide it. And just commenting on what's been presented thus far, I think there's absolutely work that we can do and move forward in around creating value, you know, according to Porter's equation of improving outcomes and taking out cost, and working in a co-creation type model that I'm sure we'll talk about more going forward about how we can deliver that. So the challenges for me are, you know, the macro challenges we've already discussed around, you know, the aging population and the tightening of budgets, etc. But for me, and Lars spoke about it briefly, was around the changing environment for us, certainly in the stakeholder management, and around that consensus-based selling and that risk-adverse culture that exists within healthcare with the tightening of budgets. And CEB have published enough times and speak about enough about this consensus-based selling, where it states that 5.4 individuals are now involved in making that decision. The latest news is it's gone up to 7.3, which is the wrong direction, certainly from our side. And when you consider that there's when you have 2 people in the decision-making process, there's 55% chance of success, and if you've got over 6, it goes down to 31% chance of getting the decision that you want, again, according to CEB. So these are challenges in terms of the number of people, but also, again, as Lars mentioned, and we'll all know about the change in individuals, and it never ceases to amaze me, especially when we talk more around digital and value-based healthcare, the number of different individuals that we talk to that is away from the traditional healthcare leader or clinician to, you know, procurement, finance, deputy director of finance, middle management, and increasingly, certainly in the UK, the transformation teams and transformation directors that exist within hospitals. And not only that, we know about the time decrease that we have with our customers. We did some work with ZS Consulting to analyse that, and we saw how little time our salespeople have with those customer groups, and yet we expect our marketing capability and our sales capability to have tailored messages, as Paul stated, which is absolutely right, and be, you know, enable us to deliver those. So really, for me, the impact is that the old model that we've traditionally worked through, and I've certainly grown up with, having been out there in the sales force, needs to evolve and to really meet the customer requirements. And if there's nothing else from this webinar, for me, the biggest reading and learning I took from a paper that's just been updated from Boston Consulting Group around Milkman, a study that's been titled Milkman. And if you look at that from the first version, the second version that came out in April, it's a fascinating read where they've surveyed over 6,000 individuals in Medtech, interviewed 100 leaders, and that's from 100 different companies. And they talk about how we really need to evolve to match these problems. And we're seeing in this traditional sort of conservative organisations that are out there in the mature market that some are beginning to tip the toe into the water to a degree, some slightly more deeper than others, and some slightly earlier. But the big question for me, and one that remains unanswered, and we're all working and learning through, is what do we do, how do we do it, and in particular, when is a good time to do it, and being brave enough to take that step. So that's what I know of you from my side, Paul.
Thank you, Brynn. And just before we move on, because I want to bring in Dave next around comparisons to pharma, and then probably yourself, Lars. But before we do that, Brynn, I wonder if you can just briefly define consensus-based selling for anybody who's not familiar with the concept.
Yeah, so apologies for that. From my side, the consensus-based would be where you have a group of people making a decision as to whether they will go ahead with a purchase or a deal. So it's gone away from the ability that you have one person who's willing to stand alone and say yes or no, to having to get 5, 6 different people with different agendas in the room to say yes or no, which is always difficult. And the other question I have, it'd be interesting for the panel, Paul, and for the audience, is around, are we as organisations dealing with healthcare environment, behaving in the same way with this consensus-based decision-making that we have within organisations, which can also avoid us taking risks as individuals and avoid us becoming agile and reacting to the market as we may need to.
Very interesting. Well, people can cast their observations as well as their questions by clicking on the questions tab. Feel free to do that. So thank you for that definition, consensus-based selling, network selling. I guess we've seen some of this, Dave, within the pharma sector with the rise of key account management trying to manage these multiple stakeholders. So can I get your views in terms of where we think Medtech is in comparison to pharma, and are the challenges the same? Are there things we can learn from that?
Yeah, it sounds like it's in a very early state, like pharma. I think pharma, again, as I mentioned earlier, if you look outside of the sector, healthcare sector, and looked at marketing and moved a marketeer into a Coca-Cola, it's a completely different beast. It's a completely different language, and it's almost probably about 10 to 15 years behind. So one of the key issues I think pharma hasn't grasped in general is, I'll give one definition of content marketing from the Content Marketing Institute, and that's your customers don't care about you, your products, or your services. They only care about themselves and how you could potentially help them. So that as a mindset shift from I need to tell the customer this to I need to engage the customer to give them value so I can help them do their job better, and they can use my products as part of the solution, is the mentality shift that's sort of missing in sort of pharma planning and the healthcare sector as a whole. And when you start to embrace that and you start to think about content differently and engagement models differently, you will see that you're not trying to influence the one-to-one selling model like we did before. It's that word-of-mouth marketing. So we'll start to look at network marketing, we'll start to look at word-of-mouth marketing, and you'll start to see a big evolution happening. And it becomes key account selling, and you'll have a much more complicated buying process. And traditional methods of just pushing key messages don't really resonate in there. You need to look at more of the behavioral science about influence and start to apply that to how you engage, and then you'll notice a big difference happening. I don't think pharma is anywhere near where it should be, but that's the challenge of this transformation. And I think it doesn't take much for an organization to start on that way and set that vision. As I was saying to one of my colleagues the other day, digital transformation isn't difficult. My local restaurant has a Facebook page. It does content for me. It sends me emails. It sends me flyers. It engages me regularly on virtually no budget, and it's quite a level playing field, but we're trying to evolve from where we were. And that's the challenge that the pharma faces, and I think Medtech faces as a whole.
Thank you, Dave. So I'm sort of keeping one eye on time because I want to keep moving on through the other questions. But before we do that, Lars, I wanted to bring you back in because we've heard some commentary there from Brynn and Dave around the challenges. You, of course, have a view from working with pharma and Medtech. Do you think there are consistent challenges there and observations on, how technology fits in with that content marketing approach?
Yeah, I do believe so. I have been fortunate enough to just spend the last 36 hours with a tier 1 pharma company in different workshops, and I think that the really toughest issue for pharma and medtech to grasp is this dynamic world of consumer interests changing much, much faster than the strategy procedures and the execution of those strategies inside the pharma and medtech companies. It hurts me even more because I've spent more than 20 years in the technology industry, and there I've always learned to fail fast. Expose your initiatives, your technology, your products to consumers. The more critical, the better, in order to fail fast and therefore not miss too much investment and too much traction. And I put that up against the risk-averse nature of life science companies. The risk of failure. That is completely contrary to the fail fast objective of technology. And if in consumers, if they are using more and more technology, expecting us to use more and more technology, well, they're expecting us to move a lot faster than we are today. Mm-hmm. So that I see sort of as one of the key issues, and I very much second what David said about that the smart use of content marketing and the thinking like a Coca-Cola can very much move us in that direction.
Thank you, Lars. So,
Paul, sorry, Brynn, I was just going to jump in there. Sorry, because
sure.
In terms of that culture, Lars, and your point, I agree with, and there seems to be this big expectation and move for our sales force to change and evolve and learn with all of the challenges that we've spoken about, and maybe take on different sales models, and we invest in that. Yet the rest of the organization to change in alignment with that, with what you've mentioned, it seems more risk adverse. But yet we expect the salespeople, when we tell them to change, to go and do something different and train them on that. And that seems a contradiction to me, which as an ex-salesperson can be frustrating, I'd imagine.
Yeah. Good observation. So I know Jerome and Georgie, you've been very sort of patient after your presentations. I wanted to get your views before we move on to the next question, and just perhaps to ask you in terms of this fail fast concept, whether you see that happening within the medtech sector in a sense of how we're learning through customer engagement. Jerome, did you want to comment on that first?
Yeah, I think as already mentioned, there is the medtech industry is not particularly forward in embracing the digital interactions. We still have the very, I believe, very traditional model, and very sales-centric, with the use to some extent of some digital aids. What I would say is that more and more there are some audiences that are not sales facing, and I see a lot of increase of attention towards these kind of audiences, and this is in my mind where really the digital transformation plays a big role.
Very interesting. And Georgie, your perspective on that as well?
Yeah, I think the word transformation keeps coming up, and I think this is an important one because it is about the transformation of the ecosystem we're working in, as well as our own organizations. And there was a comment that both, I think, Brynn and Dave made about the requirement to bring in new capabilities, new talent requirements, to help shift the organization itself, because it is a very different model that we're needing to move to. That does require a very agile method of not fully baked products being ready, collaborating with customers in the development of those solutions and capabilities, and being able to, whether it's fail or not, it's more iterate along the way using, as you mentioned, behavioral sciences, learning along the way and improvements along the way, but that requires the organization itself to shift with new capabilities, new talent coming in, and measuring that with sustaining your current business model. And that is a challenge that we're all being faced with, and I think trying to adapt to as best or as fast as we can.
Yeah, very interesting. I think it is starting to happen, but I think we would probably all agree there is a challenge there. let me move things on, because we've got a couple of talking points we want to get through beyond this, and I think we're starting to lean into some of this discussion. So let's have a frank discussion around some of the barriers here. We seem to have a good vision of where we need to be, or where we want to be, when it comes to digital customer engagement in medtech. But what do we think are some of the barriers to achieving this? And as we go through this talking point, I'm going to leave that second poll open, because that is asking exactly the question of what's preventing you from using digital to engage with your customers. So we'll come back to that a bit later on. But Dave, perhaps I can come to you first on this one, and again, just reflect on the pharma industry and relevance to medtech, what barriers you've seen there, and perhaps how we're overcoming those.
I think it comes back to that agility. So the planning cycle in pharma tends to be typically a year. And if you're looking to do new models, you need to be much more agile. You need to constantly iterate. You constantly need to look at what good looks like and course correct. You need to focus your efforts on seeing what's working, doing more of, experimenting. That's the biggest shift in the organization is people, because we haven't got people trained to be agile. We haven't got people that are trained in these new skill sets. So it's a big change management process within the organisation that we have to face. And having introduced into 2 companies now agile marketing as a concept, it can radically change planning process, make it more swifter, more focused on quality rather than delivery, and it can make a big difference. But to try and embed that fully within the organisation requires a lot of investment and a lot of set shift through the organization, not just through an individual team. And I think once you get leadership buy-in for that, you can move in the right direction. But as I said earlier, you're trying to change while operating an existing business model, and there's a risk associated with that. And as we mentioned before, pharma and medtech aren't very risk averse. So we have a challenge that we know we need to go digital. We don't want to take risks, but we have to sort of move in the right direction. And we also have to look outside of healthcare to see what excellence looks like, not what excellence looks like in healthcare.
Yeah, so agility, you would say, is one of the key factors here.
Yeah.
Georgia, maybe I can come back to you on this point, because we talk about the medtech industry. You might intrinsically expect it to be slightly more agile than pharma because it's closer to the non-med tech industry. But we know there are complex structures within medtech, matrix-driven decision environments. So do you think agility is a factor, or is that something that we're seeing change within medtech when it comes to customer engagement?
Oh, I think it's definitely something we're seeing change. I mean, I think, interestingly enough, even in our own organization, we have to become more agile. It's part of it. Is that it's part of the environment that we're working in. And I think, as interestingly enough, as we start to build our own internal capabilities in things like digital and IT, because those industries work in an agile manner, it sort of permeates into the way we're working as well. I think with our customers and customer engagement, again, the healthcare sector, as I think was mentioned by quite a few people, is challenged to work in that manner itself, intrinsically. So you sort of are hit with two sides of industries that don't naturally, or customers and ourselves that don't naturally work in that manner, and trying to rapidly change to do that. So I do think it's changing, and I think the coming of digital and technology into our working environment is bringing that change along with it.
Yeah, but I guess with any change, there's always pressure on the C-level folks to justify the change and where is this going to take us. So I almost hate to throw in the really knotty question of return on investment, ROI. But could this be a factor? And Jerome, I'm sorry, I'm going to put this tricky question to you, because nobody likes the hot potato of ROI, but is the need to demonstrate ROI one of the biggest barriers here with digital customer engagement?
So it is a knotty question indeed, and this definitely comes up into discussions, and it's clearly a factor of the level of investment that we're able to put into digital. I wouldn't say that it's the number one barrier in my experience. I've been in different organizations with different perspectives there. Some organizations are very lead focused, and in those kind of organizations, typically this is where the ROI plays quite an important part. And the good thing with lead generation models is that it's somehow easier to demonstrate the ROI if you just set things up carefully. My more recent experiences are more towards non-lead generation kind of initiatives. In that case, it makes the ROI much more difficult to demonstrate, and it's more a matter of establishing some clear metrics that can get you close to some notion of return. But in that case, it's more difficult, and hopefully with those metrics you can build a case and demonstrate the value of the initiatives.
Yeah, and maybe we're applying slightly more scrutiny to ROI in a digital customer engagement sense than perhaps we are in other areas. To your point about lead generation. Lars, can I come back to you on this, because I'm guessing I don't need to convince you of the ROI of digital customer engagement because you're at the forefront of this. But my question is more, are you seeing a shift within your customers, within Medtech and Pharma, around some of these case studies emerging and senior people recognising the value?
Yes and no. I'd hate to admit it, but it really does depend on two things. On the C-suite, of course, that we can always blame because they look at ROI in terms of only sort of dollar signs. But really, the other people I think we can work a lot with are those responsible for the sales and marketing organizations, because they have sort of been used to also measuring ROI in terms of sales numbers or point of sales information and so on. And there are many other ways of looking not so much at lagging indicators that are results of an effort, but actually looking at the leading indicators and those efforts put into it. So if you start measuring the different initiatives and time spent with different stakeholders, key messages understood, responses from HCPs to questionnaires and proper engagements with consumers, then you can get a lot of metrics that can be very convincing, and that may, certainly in early days of digital transformation, may be much more readily available than the actual sort of end effect of increased sales. So I think we can do ourselves a favor of thinking long and hard over what different ways might ROI be measured.
Yeah, absolutely. It's not one simple answer, is it? Brynn, I'm going to ask you to briefly come back in on this second point, and I'm going to ask you to reflect on the poll. And this really is a straw poll. I think we got you perplexed with this one, those are listening in, because a much smaller number of you voted on this. And we asked you what's preventing you from using digital to engage with your customers. Now, what's come out as a major factor is lack of resource and internal expertise, interestingly enough. ROI is featuring, but that lack of resource and internal expertise is coming out as a big factor. So my question to you, Brynn, is, do you see particular areas within Medtech, from your experience, where perhaps it's leading on that resource and internal expertise when it comes to digital customer engagement?
Yeah, it's an interesting one as well. I was just going to comment on ROI quickly. I wonder when Henry T. Ford said, if I ask my customers what they want and they would say a faster horse, I wonder what ROI analysis he did when he built his first car.
Good point.
For me, around that internal expertise, it was fascinating when I shifted from the conventional the business of Smith & Nephew into the new business model sort of ventures that we're looking at. And I set about this to try and build a team to do so. And I wanted a marketing director who would reside in Switzerland, speak 2 or 3 different languages with experience of Medtech plus digital plus marketing communications all wrapped into one for a modest salary. So clearly I was unsuccessful. And for me, what I've learned, if nothing else, in the last 2 years is if you follow that process of understanding what you want to get and the shift that Paul spoke about in one of his first slide to the new way, it's then outsourcing the skill set you need, partly being digital and technology, to really test what you're trying to achieve. So you're not committing to a headcount or a long-term budget or a forecasting around that. I really think it's taking the P&L or the budget that you have and looking at partners that you can work with. Because the other thing I'm finding is that after 6 months, 12 months, what your needs are going to be different at that time than it was 6, 12 months ago. So therefore you might have to change partners or evolve and co-create with your partners to do that. So that's really the view that I would have, and being comfortable not traditionally building up internal expertise and big headcount. It's being lean and agile and partnering with the right outsourced capability that you require.
Thank you, Brynn. I'm going to keep things marching on because, believe it or not, we're heading into the last 10 minutes. We always sort of whiz through these discussions. So I want to move on to the third point, and while we chat about this, I'm going to activate the final poll, which is asking you which digital channels do you most use to engage with customers. Again, it's selecting one. You may feel none of these, but if you do feel one of these, please select the one which you think is most useful in engaging with customers. But the final topic I want to touch on, I think we've already started to move into this, is really what is the best role for technology in engaging with a growing number of customers and demonstrating the benefit with those different customer bases. Perhaps, Jerome, I can come to you first on this one to sort of give me your thoughts on where you think it yields the most benefits.
The first observation I would make there is that actually we're pushed toward this technology adoption direction, and the point I wanted to make in the introduction is that it's not an option. It's something that we have to get into. In terms of opportunities for us, the way I see it is that it creates a lot more possibilities to get to know the audience you want to talk to, and to get more intimately connected with this audience, and therefore to have a number of different influencing capabilities towards these audiences. So a lot of possibilities. The challenge is then to filter out what is nice to have and not really strictly necessary for your organization. So the number of possibility is really great. The challenge is actually this number. So this is what I'm currently experiencing.
Yeah. So the power of technology in building those relationships, working out what works and perhaps what doesn't. So, Georgia, let me come back to you on that point, because as you've outlined earlier, you've tried a number of different things here, and I'd hark back to your role of value creation. Do you have a view on where you've seen technology create the most value in terms of customer engagement?
Yeah, I think it's the part of bringing the HCPs, providers, payers, and the patients together. And I have to say, one of the important parts in that, and I hark back to one of the comments that was just made around doing it in agile, but trying to decomplexify it and understand as you're building those connectivities and those platforms, is that content is really important. Continually being able to look at customer experience and user experience and ensure that you're continuing to innovate on those platforms in the way that it's delivered. So for lack of a better term, it needs to be light and agile in the way that you're developing it, so that you can constantly keep improving that engagement, because that is the only way that you'll be able to drive value out of these systems. And that, again, goes back to that big challenge of our sector of working on something that's a continuous improvement process to derive value from it as you're working through that development.
Yeah, so I mean the old tech adage of it's never finished, it's continually beta and continually being developed. Very interesting. Lars, I'm going to come back to you on this point, because you've obviously been looking very closely at where technology fits in. what do you think is the best application of technology, and what does that technology look like when it comes to customer engagement?
You put a smile on my face, Paul, because it's possibly a question I can't quite answer, because it's a question really for the individual consumer and the individual stakeholder. They are all they all have a myriad of expectations, and it's when you are able to meet the expectations of that individual stakeholder or consumer that you have a positive outcome using technology. I realize, of course, that you can't, neither as a pharma company or as a medtech company, you can't apply all technologies at any point in time. But when you work on your segmentation strategies and your personas and so on in your marketing strategy, it's worth identifying their likelihood to use different technologies to interact with medtech companies, or those that you empower as a medtech companies like HCPs and so on, and then start with those that have most preference. And the question is then, of course, whether for your products, whether that is on social media, whether it is in face-to-face meetings, or it is something that the consumer or stakeholder can basically handle at their own time and place. So it's a good question.
And of course, I knew it was a trick question when I asked you, because as you're describing, I guess there is no one-size-fits-all. Technology is important, but the experience of knowing where to apply it and the right technology at the right time is equally important. We are coming rapidly up against the hour. We could talk through this a lot. I just wanted to sort of invite Brynn or Dave if there's anything briefly they wanted to add around the role of technology, and then I wanted just to get each of you to sum up a sort of 30-second what your key takeaway would be for people listening in. Brynn, Dave, were there any brief comments you wanted to add to this?
Can I just add one thing about the technology?
Sure.
The technology is an enabler of the engagement model that you actually want to do. So it's a delivery mechanism for content, and it informs you on how to improve that engagement. It informs you on how best to promote and how best to improve the experience for the customer. And what we've tended to do in pharma and healthcare is almost try to replicate a rep, have a remote rep, have a digital rep, and we think that marketing is about giving key messages. So therefore it's often been used as a way to deliver bad engagement. And in some ways the engagement's got poorer due to technology when it can actually get significantly better. So therefore some of the metrics that we'll start to look at will be things like net promoter scores and various other new metrics which looks at our relationship with the customer. So we'll start to see that developing over time as opposed to a digitized version of our old model.
Very good. So I'm going to move into Brynn, was there anything you briefly wanted to add around this particular question?
No, I'm good on conscious of time. Thank you.
Very, very good. Well, I might let you lead then, Brynn, in terms of, I just want like a 30 seconds or less summary of we've talked a lot about the challenges of digital engagement, the opportunities. One or two takeaways from you in terms of people listening in. What's your advice? What are the key things you think we should take away from this?
Yeah, so from my side, I'd say as it's just been said, technology is an enabler, so look at the process and look at what the goal is that you're trying to achieve through that. But fundamentally for me, it's about culture. It's about being brave enough and courageous enough and resilient enough to allocate your budget, try something different. Don't try and make it perfect, and when you say that perfect gets in the way of good, try it and get a group of you together to really learn from that process. And it's liberating, it's enjoyable, and I'd urge you all to be brave enough to go ahead. Thank you for inviting me on this. It's a pleasure.
You're welcome. Thank you. Thank you for your closing thoughts. And next I'm going to come on to you, Georgia, if you'd like to give your quick takeaway from this.
Yeah, absolutely. I just to reiterate what everyone says, I think for us in the industry, it's really important to think that it's where can technology add value, and then being able to do that in an iterative manner. It's not like selling products or anything else. It's a totally different environment. So really to look at co-creating that iterative process and having to be agile and really push the boundaries in that space to be successful.
Very good. Jerome?
Yes, on my side, there is a term that came a few times, agility. I think this is a really important one, and the ability to take risk as well. So trial and error is probably a good concept for the digital enablement of Medtech organization.
Thank you. And Dave, I think you hinted at this in your previous answer, but your sort of quick summary of the key takeaway here?
I think we need to change our mindset in terms of what this digital transformation is, rather than use it as a way to evolve what we've currently got. We need to evolve, but with a clear direction of what our future engagement model should be. And it's about adding value to the customers and at the same time driving our business. And that's the challenge we've got to face.
Very good. And I'm going to leave the final word on this to Lars. I'm going to skip past the slide that says questions because I've been weaving in your questions as we go through, even though you wouldn't necessarily notice. So, Lars, some closing thoughts from you on this?
Yes, two main thoughts, basically, because over the years I've been meeting so many medtech and pharma companies, and I can say with the hand on my heart that every single one of them have one or more initiatives in one or more areas of technology. But I very much agree with David's comment earlier that it's really most important to have the content and the messaging right to the consumer, what they expect. I just add to that it's when the technology and the content, the messages, when they work together, that you can gather the most data and the right data and put it back at the fingertips of those to whom it is most important. And then, to my second point, you might just be able to start proving that the return on investment of your initiatives are so good that they can indeed stand the scrutiny of the C-suite. Like in this graph where we have the common belief really that time spent with HCPs in face-to-face engagements have been ever decreasing over the last 10 years. But in fact, if you apply the right technology and indeed the right content, you might actually be able to reverse that trend. So, and therefore have a very positive ROI and a powerful evolution of your digital transformation.
Yeah, and I think that's a key point because often you hear people talk about digital versus face-to-face, and I think this illustrates it's not. It's synergistic. It's complementing what we've been doing. Very good. So we're just a little bit over time. That's my indulgence. We've got a very big subject to cover here. Just to briefly wrap things up, we've covered broad ground. We can focus in. We'd love to do more of this. So please provide your feedback. You can rate the webinar, those of you who've been listening, and you can add comments. So feel free in the comments to focus in on what you thought was good about this, areas that you'd like to cover off in more detail, potential topics for future webinars as well. Thank you to all of you for listening in. As I said before, this will be on demand the minute that we finish. So if you come in halfway or you've missed bits or you have colleagues that you know will be interested, you can use the same link. It'll be on demand. And the contact details you can see there on the screen for Lars if you have further questions that you want to put to him. But I want to say an enormous thank you to all of our panellists today. So thank you, Jerome, Brynn, Georgia, and Dave. We really appreciate your time. And thank you, of course, to Lars for taking part and to Agnicio for being our sponsor today. We will hope to see you on the next webinar. Thank you very much for listening, and that's all for now.